One of the things that I did, even just kind of recording education on endometriosis, was like, your period shouldn't hurt. You know what I mean? Because you hear about so many women and they're like doubled over in pain and they can't work and they have to be like taken. That's not normal, guys. You know what I mean? Like that should not be, you should not be like stopping all of your activities because of your cycle. Like,
right.
Go get that checked out.
Yeah.
So it's one of those things. And you might have to like you keep going and keep advocating for yourself. So I'm finding out more information as well as I'm doing research. So
yeah, and it really is, I think, everybody's experience is a little bit different, because I felt like, I didn't have any cycle irregularity or anything till I was 30. So it wasn't like the classic patient where, they've been complaining ever since their teen years that they've had unbelievably painful periods. So it's like, I would have said, mildly painful, not debilitating. I never missed work or school because of them or anything like that. And then it was just sort of in my 30s, cycle length got really weird, but then they adjusted thyroid meds and then that straightened out. And then everything was just, I would have said like my cycles were like clockwork. I did not have, sort of,
like
an irregular cycle length. Yeah, no, it wasn't any of the sort of like classic, oh my gosh, it was, a normal, like probably 29, 30 day cycle, like a 5 to 6 day long period. And then it was probably my mid 30s when all of a sudden, like my bleeding was much worse during my period. And then eventually, I'm not even sure. I think I felt mild discomfort in my abdomen, and I was like, oh, maybe it's a UTI. I think it's a UTI. And I went into urgent care, and they, did the like urine stick test. Everything was fine. But then the woman that examined me was like, oh, well, I feel your uterus feels enlarged. And I was like,
interesting.
So
you had a like, we're just hopping right into it, which is fine. You had they did a pelvic exam at the urgent care.
Yes. Yeah.
Which they usually don't like to do, just like FYI. You know what I mean?
Yeah.
Like, that's usually not their thing.
Right. And I think, this was sort of like a sick visit appointment it wasn't with my regular practitioner, but it was in the primary care office. So I think she was a primary care provider for her group of patients, but then she had sort of like the sick visit slot coverage. And so, and she was just sort of like palpating and was like, oh, that's really weird. Well, I'm going to send you down for an x-ray right away. And I was like, okay, well, now I'm getting nervous. Right. And I remember thinking like, oh my gosh, is it like the TV show where I'm pregnant and I just don't know? And
how fun would that be?
I was like completely freaking out. And they did the x-ray, but the x-ray didn't show anything, which wasn't surprising because it was, soft tissue.
Right.
And that was the fibroid. So that was like the first discovery of a uterine fibroid. And then they had scheduled me for follow-ups with OBGYN and to do transvaginal ultrasound. And then that's when they were like, oh, there's a giant fibroid and a large cyst on the right ovary. And then eventually that led to, sort of after consultation with the OBGYN, is that they were going to do surgery to remove the fibroid and examine the cyst more closely and make a decision about whether the ovary had to come out as well. So they did the myomectomy surgery. The doctor, they had to do an open abdominal incision. I think because, partially the size of the fibroid, but also because of the very rare risk that there could be cancer within the body of the fibroid itself. And it wasn't anything about my particular scans that indicated that would be the case, but there was a really famous case of a Boston doctor who had morcellation, like the grinding of the fibroid during removal. And she had one of those very rare cancers sort of in the center of the fibroid.
Oh boy.
And they basically seeded her entire abdominal cavity with cancer. And she ultimately died from it. So they didn't want to do any of the sort of morcellation or chopping up of it. They wanted to remove it intact. I think, by the time I had the surgery to have it removed, it was something like, I don't know, like 9 inches across. They measured centimeters. It was large.
Yes.
Like, Nerf football.
Yes, Christa. I'm like, that's big.
A whole good thing. And but then
from there, the only thing that indicated that there was a mass that size was that pelvic exam where she just felt an enlarged uterus.
Yes. Yep. Yeah.
Interesting.
Exactly. Yeah. And then, the ultrasound definitely confirmed that there was a fibroid there. And it was a couple of months of waiting between sort of detection of it, getting the ultrasound, and then getting the surgery. Just sort of scheduling the surgery took a little while. But I felt like it definitely had grown relatively quickly because I hadn't detected anything, myself until it was sort of either pushing against the bladder or interfering with, urination in some way where I was like, that's weird. That's different.
Right.
And then, and the surgeon had seemed quite impressed when she removed it. It was massive. It was growing outside of the uterus on a tiny stalk. So the stalk of this 9-inch orb was less than an inch across. It was like this tiny little stalk. And it had grown off of the top of the uterus itself. So it wasn't embedded in the walls of the uterus. I had some small fibroids in the wall of the uterus, but they didn't have to cut away at any of the muscle walls in the uterus at all. They sort of just had to remove its top hat.
You're so funny.
And so they did that. And when I had come out of the surgery, and when I was recovering, that surgeon had said, well, I couldn't get a good visual on the right ovary, but I palpated it and it feels fine. It's fine. And then I would say a week or two, probably 2 weeks, far enough along in the recovery that I shouldn't be generating any new pain from the incision area or anything like that. And I was like, gosh, something is just
doesn't feel right.
Yeah, something is wrong. And it's like this just sharp pain on the right side. And I was like, well, maybe it's scar tissue. Maybe it's part of the healing process. And I think I was maybe a month after the surgery, and it was just a debilitating pain, doubled over. I'd be at work, and it seemed particularly aggravated anytime I ate something. And I couldn't figure out, I was like, after I would eat, I would just be doubled over in pain. And then eventually the pain would, subside. But I remember just being before teaching in the afternoon, and a coworker came in, and I was bent over a lab bench, tears in my eyes. And she was just like, what is wrong? And I was like, I don't know, but it's not right.
Right. Okay. So how long after surgery
was
this happening?
About
a month. Okay. Okay.
And the amount of pain that led me to the ER.
And let's keep in mind, you are educated.
Yes.
You have a doctorate in biology, correct?
Yes. Yeah.
So it is not like you don't know and you don't have a clue as to kind of the language that they're speaking and those kinds of things. You have an awareness that most folks who suffer from this may not usually have.
Right. So and I called, that during that month-long process, I called my primary care office every week, sometimes twice a week.
Wow.
Sort of describing the pain and that it was excruciating and, kind of what was going on. And they just kept saying well, we don't need to see you till 6 weeks after. We don't, you're not going to come in until the 6-week mark and, take Advil, alternate it with Tylenol and, good luck.
Did you have to follow up with the surgeon?
Yes. Yeah. So, but before I could even make it to the follow-up, I ended up in the ER because the pain was it was just like a stabbing, penetrating pain on the right side. And they did a CT scan, and there was a 7-centimeter ovarian cyst on the right side.
Wow.
The side where she said everything felt fine. And that even during an open myomectomy, you know, it's like my abdomen's open, your hands are on my uterus. What do you mean you couldn't like get a visual of my right ovary? Like, where else would it be?
So I'm curious to think, because again, you have an awareness that some people don't. What do you think? You think she just didn't look? She just
I think
tumor and just was like, all right, let's go.
Yeah, I think partially, you know, I think the top priority for sure seemed like it was, you know, removal of the fibroid, because that was such the obvious problem.
Right.
I think she maybe, you know, felt just so confident in her abilities that she didn't feel like she needed to do the due diligence to investigate further. I do think, you know, my experience with her, she was very focused on sort of future potential reproduction. And so her approach to kind of why the fibroid needed to come out is really like, you know, I remember her telling me after I, like the next day after the surgery, and coming in and patting my hand, you know, and sitting with me and just kind of squeezing my hand and being like, you know, and just to, you know, in a couple of weeks, you know, if you want to, you know, put a baby in there, like you can, you know, you can go ahead and try. And this was after we had very clear conversations where I said, you know, I mean, at that point I'd been married for 10 years. We, you know, if I had gotten pregnant, fine, but it wasn't like any intentional plan at all. And to me, it was, when I went in for the fibroid removal, I knew all the women on my mother's side, as far as, I mean, my records don't go that far back, but they had all had hysterectomies due to fibroids, some due to endometriosis. And so I sort of knew, you know, at that point, I was 35 and saying like, or no, I was approaching 40, I guess. And then I was sort of like, the writing is on the wall. If we don't do a hysterectomy now, I don't want to be back in here having another major surgery when I know that this is the direction I'm headed. But they refused to do the hysterectomy at the first surgery. And so I think some of the like, well, how do you miss such a large cyst on an ovary? And it wasn't a functional cyst. It wasn't related to ovulation. Because when I was in the ER and I told the guy, like, oh, I've heard about ovarian cysts. They're just gonna, like, it's gonna pop and it's gonna resorb and everything will be fine. And he just went, no, this one isn't going anywhere.
Oh, wow. Okay.
So it was,
that's kind of when you were like, oh, wait a minute.
Right. It wasn't like fluid-filled sac. It was, you know, it was solid mass, not no indicator that was ovarian cancer, but it turns out it was an endometrioma. And so that endometrioma had to have been present a month earlier when they did the surgery. And this idea of like, well, we palpated your ovary and it felt fine. I just felt like, you know, they were reluctant to be incredibly thorough, reluctant to do anything that might compromise fertility, and therefore kind of left the ovary in there. After I had the CT results and in the ER, and then I brought it back to that OBGYN, all of a sudden, you know, the phone calls every week of like, help me. This is excruciating. All of a sudden I go into the office and it's like, we have surgery booked for you 2 weeks from today.
So it wasn't even, let's examine, talk about, like, they were absolutely like, no, we're going back in.
Yeah.
Yeah. Wow. Okay.
And then, but it was, you know, we'll go in laparoscopically. So it was the same surgeon from the first surgery. She had said, we'll go in laparoscopically, 2 hours. We're done. And I come to post-surgery. It has been about 9 hours. The surgery
is 9 hours. Let's talk about that. I don't think that is not the expectation.
Right.
So right off the bat, your husband and you, after figuring out the time frame, realize this is off. This is not how this should have been going.
Right. And it was my husband that was sitting there with me, sort of in recovery, explaining, saying, I'm really sorry. They had to do another open abdominal surgery. So the first surgery, they had gone in horizontally.
Okay.
The second surgery, they went in vertically. And then he said, they got in there and the adhesions were so numerous that it was like your abdomen was just super glued together.
Oh, wow.
And he said they called in 2 other surgeons. So there were a total of 3 surgeons, and it took them 8 hours to cut the adhesions away, and then get to the endometrioma, and then to remove the ovary and the fallopian tube on the right side. And that the source of the pain that I kept feeling shortly after eating was because the endometrioma had fused itself to my intestines on the right side.
Gotcha.
So
anytime you had food pass through that area.
Yeah, right, exactly. So anytime the gut would normally be moving or contracting, that whenever it sort of passed that location was incredibly painful.
Wow.
And explained a lot of those symptoms. So they successfully they'd cut away all the adhesions. I was told that and I don't, even knowing some anatomy, I can't picture this, but that they had sort of extensively rinsed off my intestines. I was told that they were like picked up, rinsed off a lot, back in, to try to discourage future adhesions from forming.
So were all the adhesions from the previous surgery, or it was just from that endometrioma that had kind of spread, I guess you could say?
I think probably from the first surgery, because they didn't encounter that when they went in to remove the fibroid that would have been on top of the uterus. And so I feel like if they had been opening into my abdominal cavity that first time and there were all those adhesions, they would have sort of encountered that.
Right.
But whatever my body did after first surgery,
you super healed. Really,
yeah.
really. That's usually what I call it. I'm like, you're a super healer.
Right. Not the best superpower to have.
Right.
But the adhesions and the fusion of the endometrioma to the intestine, that was probably already happening and already kind of there and resulting from all the sort of scar tissue forming sort of around the ovary itself. And so, so that was, we're almost 6 years ago now. And then, recovered from that surgery. That was a much harder recovery, I think, just given how close it was to the first surgery to remove the fibroid, and then also sort of the vertical, you can correct me if I'm wrong, because you would know this anatomically better than I do. But cutting of muscle groups vertically in the abdomen, as opposed to in between layers of muscle, horizontally, and then they just
instead of like peeling you like an onion. That's usually how I kind of explain it. Instead of peeling you like an onion, like layer by layer, when they went vertically, they just kind of, like a banana, I guess is the best, way to kind of put it.
That's what it felt like.
Right. And keep in mind though, like you said, since the surgeries were so close, the recovery from that type of surgery alone is 6 to 8 weeks.
Right.
Minimum.
Yeah.
So you're going back in 4 weeks right after the first one? You are not even remotely healed, from the first one. So you're still very much in pain, can't lift, can't do all those things.
Yeah.
And then they're sending you back in and cutting different muscle groups again, including the ones that you already had cut.
Yeah.
So
it was a lot.
Yeah, it was a lot. It is not something we would absolutely be like, yes, do that. No, that is not that is not it at all.
And and then eventually that healed, and but I would say over the past, so maybe like we do timeline that surgery 5-6 years ago, probably almost 6, is that maybe 2 years after that surgery, I started having more discomfort, still on the right side, and that enough that I would bug my PCP every year and sort of be like, I still have this pain, I still have this pain, I have this like nagging pain, and they, they did another transvaginal ultrasound, they didn't see anything. And they were just like, yeah, you're fine. And then, this would sort of be our back and forth all the time for the last.
Because like you said, this is 6 years ago, like those surgeries 6 years ago.
Right. And then, COVID, COVID happens and I'm like,
COVID happens.
Right. And I'm like, I still have this pain, this nagging pain, and it just won't go away. And I definitely feel like it's getting worse, but I'm kind of just adapting to it because now we're in peak pandemic and I don't want to leave the house.
Correct. And we don't want to be in the hospital.
Right. Because I was like, there are things worse than nagging abdominal pain. And that would be COVID, without a vaccine. So I was like, I'll just hide. And I did that for like 2 years. But it sort of, I realize it now looking back that I was progressively able to do less and less, like engage less and less with stuff that I would never think twice about. It would get to a point where I was like, asking my husband, like, hey, do you mind walking the dogs today? I'm just, so tired. Or, it's a really hard thing for me. And I kept thinking like, I'm just out of shape. I never really, like after those surgeries, it just took such a toll kind of on me physically.
Of course, yeah.
But I never really returned to like the pre-surgery kind of fitness levels that I had been at.
Right.
And then I just sort of started blaming myself because every time I'd go to the doctor and they'd say like, well, you'd feel better if you lost weight. You feel better if you lost weight.
The thing that they do, right?
Yeah, the thing that, is such an habit. It happens all the time. And it's like, yeah, sure. In that general sense, I totally understand that. But it was sort of like, that was the only thing they could offer me in terms of me saying like, something isn't right. I just don't feel right. And then it was sort of lack of access to medical care during peak COVID. And just starting to be like, but maybe I can't walk the dogs because, we've become so sedentary. I'm working from home, I'm teaching from home, I'm not really leaving the house.
Lots of like self-talk, but like giving yourself excuses as to why you are feeling
right. And sort of like definitely a strong element of like blaming myself to say, well, if I just worked out more, maybe this wouldn't hurt so much. And not knowing the source of sort of what was causing the pain, because it wasn't the sharp acute pain at this point. It was like a deeper gnawing pain.
Interesting. Yeah. And
it was things that were painful would be standing up in the kitchen, standing at the kitchen counters, standing up to cook. It was like deep in the pelvis, internal discomfort that I would kind of joke that it felt like a rabid raccoon was like
clawing at your
off of my pelvis. And just
wow.
Back and forth.
No, I mean, that's a great visual, first of all. But also, ow, you know what I mean? Like, not pleasant at all.
Right. And I just, because I had kind of internalized it so much just being like, it's a personal failing on my part that I can't just grit my teeth and just get on with it. And so that's just what I do. I think a lot of women do that. I think women are in general doers, and not complainers. And then when you hear that kind of echoed back to you sort of by medical professionals to just sort of say like, well, if you, it's sort of your fault because if you lost weight, everything would be healed. And then, I was like, okay. And then this last spring, I developed really weird symptoms kind of out of nowhere. I definitely, at this point I had persistent enough pain that I realized, looking back, normally I would cook for us all the time. I was doing that less and less.
Gotcha.
And it was just because it really was pain, but I hadn't, it's like I recognized it for what it was, but I just blamed myself. And it was just like, you
had been gaslit this whole 6 years.
Right. Yeah, it's been a long time.
Yeah, it wasn't, it's just in your head or
right. And even going back to kind of being, right, even going back to sort of like, I don't know how you miss the ovary, but the people miss the ovary, right? And
right.
And then me complaining about that pain, and then them being like, no, you don't know what you're talking about, kind of thing. And so there was definitely that. And at a certain point, even the most persistent person kind of gives up.
Absolutely.
Seeking, validation or recognition, by medical professionals. And I kind of was like, well, maybe this is just my life now, maybe this is just what it is. And so you just adapt to that. So it was kind of like, I'm getting less and less active. I could pull off, doing the work that I need to do. I teach, I'm on my feet all the time, but I'd get home and just like collapse into a ball.
Wow.
And then, it was like, oh, okay, this isn't getting better. This is just kind of getting worse. But it was out of the blue this spring, let's say late March into April. I woke up one day and I was like, oh, my belly's kind of tender. And then it's all, super TMI, but whatever, it's all on the table. I was like, oh, maybe I'm constipated. I've never really been constipated, but maybe this is what it is.
Right.
And so I was like, take some Metamucil and see if this
happens here.
Yeah. And didn't do anything. And then I was like, oh, no, my belly's really tender. That's weird.
Question. Is it in the same vicinity of the area, the same spot?
I would say the entire lower abdomen at this point was tender. I couldn't determine any sidedness to it. It wasn't like the previous pain where it was definitely sharp, distinct, centered on the right side, where that ovary was. This was just like a diffuse, tender lower abdomen. And I went throughout the day and I was like, this is weird. And, I was constipated in the sense that I couldn't move my bowels at all. But then I spiked a small fever. It was like a 99.9. And I was like,
right.
I'll just ride this out. And I was like, maybe I'm getting the flu. Oh gosh, maybe it's COVID, because I know COVID has GI symptoms.
Right.
So I isolate myself in the back bedroom and I'm just like, let's just ride this out. Took some Advil, the fever came down. And then late that afternoon, the fever started, it hit 101. I was like, something's wrong. I don't know what this is, but something is wrong. I asked my husband to take me to the ER and I was like, just drop me off. Parking is a pain. You're going to be waiting here for hours. Just go home. So he drops me off and I'm waiting and waiting. And
that sounds familiar. Yes.
Yeah, it was a very, very long ER wait. And then they were so kind of overwhelmed that once you move from the waiting room, then they had these, set up just curtained little empty
areas,
kiosks, where you were still waiting to get back to the ER, but no longer in the waiting room. And somebody came to check on me and I was sort of explaining what was going on. I had talked to my doctor earlier and she was like, well, it might be diverticulitis. So I was like, oh, maybe it's diverticulitis. I don't know. Never had that before. And from the wait time of the little empty temporary room to when they got me into the ER, by the time they got me back there, my fever was 103.
I literally just kept increasing.
Yeah. And at that point, and I was out of it. By the time they came to escort me into the ER itself, I couldn't keep my eyes open. Wow. They were asking me what medications I take. I started going through the list and then I couldn't remember. And that was really jarring. And then they didn't have any rooms in the ER, so I'm like out on the stretcher next to the nurse's station. And they're like taking good care of me, but they're kind of like, your heart rate's really high. Your heart rate's really high. What, and I was like, I don't know. Yeah. Sometimes my pain response, I've known previously sort of at the hospital, because I kept like saying, oh, I don't need painkillers. Trying to be really tough.
I was about to say, I'm like, you are good.
But sometimes but then my heart rate would elevate, and they would notice it from my heart rate and my blood pressure. So I was like, well, maybe that's it. And then they only had the temperature data from when I had been out waiting. Mm-hmm. And then they were doing the forehead temperature thing. That wasn't super accurate. And then they said, let's do like the, underneath the tongue. And then that's when they saw like, oh my gosh, it's 103. And then they gave me heavy duty pain meds and basically had me waiting for a CT. They did the CT, and then, at that point it's like 1 a.m, and they came in and they said, you have a tube ovarian abscess on the left side. And I was like totally shocked, because I have I'm like, what?
Yes. Oh, what?
What now? And they had brought somebody down from gynecology, and she said, we're going to be admitting you. You're going to need to be on antibiotics for several days, IV antibiotics in the hospital to control the infection. And later in some of the assessments, like they were asking me questions that didn't really line up with a tube ovarian abscess. They were saying the most common cause was that bacteria would enter the vaginal canal and sort of work its way up and then seed infection. The other common cause would be an untreated STD. And at the time, I remember, because I was super out of it, being like, my husband gave me gonorrhea. Right? It's like, where else is your brain going to go, right?
Right.
And then they did the full panel, and there was nothing. There was no indicator of any sort of source of the infection, basically. So they didn't know. And so I was
like new language probably to some of the folks. So they officially call this a tubo, Tubo, ovarian abscess. Gosh, say that 3 times fast.
Right.
But a tubo ovarian abscess, which clearly has been festering for quite some time. When you were kind of your temperature was spiking, were you still in pain? I know they had given you pain meds, but was the pain worsening?
It was worsening to the point that, even with, and I think the pain med, I think it was like an IV Dilaudid or something like that.
Wow. Yeah.
Because they started an IV when I was in there and just kind of waiting. I think they started an IV on everyone in the ER, just in case. And they had given me Dilaudid, and that definitely, kind of knocked me out quite a bit.
Absolutely.
But I could not roll on my side anymore. So like by that evening, it was like, I can't, it was so tender on sort of the front lower part of my abdomen that I couldn't even roll over on the gurney. So I was just on my back, just kind of not
moving,
just waiting for people to figure stuff out. And then I think I was in there 4 or 5 days on IV antibiotics, 2 different IV antibiotics that they would alternate every, each one was every 12 hours. So they were sort of like offset by 6 hours. So, and then the symptoms subsided pretty quickly, I would say. Like the acute pain, inability to sort of move the bowels, that really kind of remedied itself within the first like 24 hours of the antibiotics. And so, but they kept doing labs and sort of seeing that my white cell count was still elevated. And I think they were seeing that typical recommendations to treat a tubo-ovarian abscess was something like 72 hours on IV antibiotics. So they kept me going a couple days longer than that, and then sent me home with really heavy duty antibiotics for 2 weeks, pills. And that when I left the hospital, I was told by another OB doing rounds that there was talk about, like, do you go in and drain this abscess? And the surgical team that they had consulted with infectious disease, they had consulted with their general surgical team, and they were all saying, like, do not go in and drain anything when she has active infection in there. And so let the infection subside and then bring her back in for a consult for surgery. But I was told you will need to have surgery to treat this, to fully clear the infection.
Okay.
So even with the antibiotics, even if your white cell count's normal, even if there's no sign of infection, surgery will need to happen to either investigate what's happening, remove the fallopian tube, and to make sure that the infection does not come back. So that was sort of the instructions I was left when I was discharged from the hospital.
Okay, so you already knew. You were like, okay, let's hope this takes care of things. However, I know that when everything is all said and done, at the end of the day, I'm gonna have to end up back doing this all over again.
Right. So I sort of knew. I was like, okay. And then my immediate thought was like, I told them 5 years ago.
Right.
I knew where I was headed because this is just kind of the family history. And I know that with every surgery like that they're pretty major surgeries.
Right.
And I had never had surgery before in my life. So I felt like anything I could do to avoid a major abdominal surgery, I wanted to do. And if that meant, a hysterectomy at 40, which didn't seem unreasonable to me, it's like, and that's what I wanted to do to make sure that it didn't keep happening.
Right. And not only that, but I mean, not to put everything out there, but you were, like you said, if that first physician was very heavy on the reproductive aspect.
Yeah, totally.
Afterwards, trying to save things in the event that you wanted to have children, and you and your husband together a long time were very clear, like, yeah, if it happens, okay, but we're kind of happy, like, not.
Right. I mean, it's sort of, it was one of those things where I was like, well, if we had we had been married for so long, we didn't actively try to prevent pregnancy, but we also weren't actively pursuing it if it didn't happen. And that's kind of like the bracket we were in. And then when it hadn't happened after like 10 years, we're like, well, we're actually fine.
Correct.
We're older now. We're tired. That sounds like a lot of work.
I'm a fantastic aunt. It's great.
Right? Yes. Like I feel very fulfilled. I don't feel any like sadness over it. Whereas I absolutely had girlfriends who many years, younger than me at the time had been like, I'd had friends that were so like just hardcore scientists, like not a lot of emotion about stuff. And then when their biological clock started ticking, they were like crying every day, saying like the one thing they needed to do was have a baby. And I would just watch them and be like, I don't feel that at all. And that's like how you kind of learn about like where your own head is at. I was like, no, I didn't feel that. And so then by the time I got to 40, I was like, I know who I am as a person. Like, I know, what I want, what I don't want. And even if I had wanted kids, I wouldn't have kept diseased organs.
Correct.
Right? Like, that wouldn't really have been functional.
And let's even talk about like, at this point, you're like, something's wrong. You're not going to pursue it.
Right.
Knowing you feel like something is off.
Right. And it was sort of, and I would have intervened medically, like with fertility stuff years before.
Right.
I was even having these conversations with the doctors. So the abscess clears up. I went to see the OBGYN who I had seen on the rounds in the hospital. She actually worked at my primary care's practice. And I followed up with her because, she was the one that kind of said when they were getting ready to send me home, was like, you are going to need surgery to remedy this. And I was like, finally, somebody that believes like something needs to be done. So I follow up with her and she says, well, here's a referral to the best surgeon in our practice, our best laparoscopic surgeon sort of within the practice. I get an appointment with her a couple they wouldn't see me until after I finished the oral antibiotics.
Right.
So it was kind of, I already had 2 weeks of oral antibiotics. And then I think I saw her maybe the week after that. And I go down to see the surgeon whose normal hospital affiliation is like, an hour away from where I am. I go all the way down there. I meet with her, and she basically says, quite nonchalantly, very confidently, oh, we don't want to do surgery. This like collective we of like, surgery is not, what we should be doing. And she said, so often as surgeons, we only say, well, when should the surgery be, as opposed to questioning whether we should do surgery at all. And I remember saying like, okay, but an entire team of, a really like, a quality hospital. This was not just like,
you're like
random like offshoot that said, yeah, you're going to need surgery. Like this is it's a pretty big hospital outside of Boston. And so I questioned the surgeon and be like, I don't understand, this happened. And they said, there's absolutely no way that this resolves fully without surgery. And she goes, no. And, and she, sort of went over the scans and kind of went over the history. And, she goes, we never really know why these abscesses happen. I mean, she knew, because I was like, well, it wasn't gonorrhea, so that wasn't weird. But it wasn't like, was it BVI? It wasn't any obvious infection.
Right.
It just seemed like a spontaneous thing. And she said, she goes, I mean, you can get a second opinion, but I wouldn't touch it. And one of the reasons she gave was, this is your last ovary. And if I go in there, I know it's going to be a mess. She goes, if I go in there, I know you're going to have a ton of scar tissue from, lots of adhesions. She goes, there'll be no way to save the ovary if I go in, because just knowing your history, that the fallopian tube is going to be so used to the ovary.
With that. Yes.
Yeah. She goes, there's potential to damage the bladder. It's basically like, this would be a disaster if we went in. So, and she just seemed so like, I'm told this is the best laparoscopic surgeon they have. She consults all over the place, like 4 gynecological laparoscopic procedures. And so when that person tells you, no, I would not go in there, you just say, oh, okay.
Right. I mean,
and
the best is telling you. And
right.
You're like,
and I've had major surgeries before. So part of me was like, yeah. Right? Like, oh, this is good. This is great, And she goes, but, it does put you at, a slightly higher risk of the abscess coming back. And, if the abscess does come back, then we absolutely have to do surgery. But, it sounded like a, if possible, when, I was like, oh, this is good. And I remember leaving the office and being like, I don't believe her, but I want to believe her. And I want to feel good about this, and and that this won't happen again, and that it's resolved. Because and the other thing is that before seeing her, they had done an ultrasound after I finished the pill-based antibiotics.
Okay.
And I remember at the time saying, shouldn't you do a CT scan? Wouldn't a CT scan give you better resolution? I want to see all the things. They're like, no, for everything in the pelvis, an ultrasound is the best way to go. That apparently is not true. Learned that the hard way. That a CT scan would have been the thing to do, but they just didn't do it.
Yes.
So, she looks at the ultrasound and it was just like, oh no, there's no infection. Everything's fine. And I didn't have a fever. My white cell count was normal. And whatever she saw, like, the fallopian tube looked a little distended, but she said that was to be expected because of the abscess. So basically that it would have blown up like a balloon, and that now it looked like a little shriveled balloon and didn't have its normal shape. So I went home thinking like, yeah, great. I get my whole summer. This is awesome. My life is back. And a month later,
here we are.
I felt the same symptom, mild tenderness in the belly, mild constipation. I didn't wait at all because I had been told the second you feel anything, you immediately just go to the ER, like call us and we will call ahead and just go to the ER.
Okay.
Sure enough, it's like a month later to the day.
Wow.
Of the other one happening, I start feeling that again. And I'm like, immediately, ER now. Something is wrong. I didn't have a fever because I caught it early enough. But I went back to the ER. They did an ultrasound. They could not see the left ovary at all because there was so much fluid.
Wow.
And now there was a mass on that side as well. But then they were like, well, we can't see the ovaries, so we have to send you for a CT scan. So it's like, yeah, you do.
Right. You're like, here we go again.
Yeah. So, and the ER doc, was great. And she sent me for the CT scan. Yes, the abscess was back. There was like a 17 centimeter pool of fluid and sort of, and some unidentifiable thing that they could mark by. Yeah, that's what you definitely want to hear after a CT is like, if you don't know what it is with a CT, then this is not good.
Exactly.
So tremendous amount of fluid. I shocked that I didn't have a fever at that point.
Right.
They admitted me to the hospital. We did the whole thing all over again. This time 4 days of IV antibiotics, another 2 weeks of pill-based antibiotics at home. But at discharge at that hospital, so this is the same one I had been to for all of my major hospital things.
Still no surgery.
Yeah. I had another new to me OBGYN doing rounds. And she came to see me the day that the day before they were going to discharge me. And she sat with me. And she actually also works at my PCP practice, but I had never met her before.
Okay.
She sat with me and she says, Christa, she goes, you are really ill. And she said, you have a serious health condition happening. And she goes, I am not supposed to tell you to go outside of our practice. She said, but I think you need a specialized team in gynecological oncology to get to the bottom of what's going on. And it was the first time anybody had ever said anything like that.
Right.
And then the flip side, there was never any talk about this being cancer. So from whatever the CT scan showed, thank goodness, at least.
Right. We were never concerned that was the issue.
You're right. So it wasn't like, oh my gosh, we're now referring you to oncology because you have cancer. Yeah. But in my mind, I was like, what?
For sure. Right.
And then I thought, well, they won't take me because if I don't have cancer, like who goes to an oncologist without cancer? And she said, I want you, as soon as you leave, to do some homework. And I want you to look at these following people. And she gave me 3 sets of names of top people at some of the best hospitals in the Boston area, all of gynecological oncology teams. And I wrote their names down. I asked her to spell them. And as soon as I went home and I knew I was taking the oral antibiotics, I started calling these numbers. And the first person that showed up was the chief of gynecological oncology at Mass General Hospital, which I have been told is one of the best hospitals that you could be at.
Yeah.
And I was like, I want that guy. I want at least somebody who, has probably seen some things in his life. I was like, oh, I'll call the office, but there's no way they're going to see me. I called the office and left a message. I got a call within 3 hours from his nurse, and they had me at an appointment, basically, as soon as the pill-based antibiotics had finished. He sent me for a CT scan after the pill-based antibiotics. So I was like, oh, well, he knows what he's doing. He ordered a CT scan.
I'm so upset that's your gauge now.
Yeah. And then I had an appointment with him 2 days later. And we kind of went over everything. I felt like I had so much like pent up emotion over everything, and also felt like I just had to like word vomit my entire history to sort of say, like, I have experienced so much medical neglect. You know, I have now had like 2 really serious abdominal abscesses, you know, and I'm like terrified. I'm absolutely terrified. Like, I need some resolution and I don't know what to do. And he was like, we are going to take care of this. And he was very wonderful, wonderful human. And still, you know, wanted to have the conversation around fertility. Like, it was amazing to me that he was kind of like, well, you know, and even if you don't have any ovaries and if you don't have a uterus and you could do this and you could do that. And I was like, nah, we're good. We're good.
Right. You're like, after, no.
Yeah. I mean, he was so nice about it. And he sort of was so like, you know, we want, you know, like, you want to talk about the options, because I totally understand, you know, and I think they think of it as, you know, here is a woman who hasn't had children.
Right.
Women want to have children older and older, so it's not unusual maybe for, you know, a 45-year-old woman to walk in and say she desperately wants to have a baby, even if she's facing a hysterectomy.
Right.
But I told him, you know, I like looked at him just like dead in the eyes, and I was like, I am not that woman. But I'm sure that's great for other women. I was like, but I am not that woman. Please take everything out.
Yes.
He just kind of like chuckled a little bit, you know, it's like, he goes, you know, I agree that it's time for everything to come out. So I had the hysterectomy scheduled for the middle of this last August. He was going to be the surgeon. He typically does the robotic hysterectomies. And he did say, and when he looked at the CT scan, he said, you know, odds are pretty good that I'll be able to do this laparoscopically, you know, with the robot. But I can't guarantee that that will be the outcome. You know, he was very sort of just honest about it, you know, and without the bravado of like, I don't need to, or we're definitely, you know, it was like, oh, no way is that going to happen, which I experienced before. He was very like, here are all the possibilities. And so I wasn't, and I just knew in my head, I was like, nothing I've ever done has gone to plan. It's like nothing has ever medically gone to plan at all. And had the surgery, woke up from the surgery to hear like, well, couldn't do it laparoscopically. So we started laparoscopically, but then we had to go in because there was a lot of like that gnawing pain I had been feeling in the base of my pelvis was so much adhesions in scar tissue. And again, it was almost like they couldn't really say whether it's all endometriosis, you know, definitely it was some mixture of either adhesions that my body had done on its own, and, you know, possibly stemming from the second surgery where they had, you know, because he was saying like anytime you touch anything in the abdomen, that you basically can kick off adhesions just from like the tactile component of touching things. So some combination of, you know, endometriosis continuing to occur, and that probably played a pretty big role in it. Also, you know, because they never treated me for endometriosis after that first surgery. You know, if you, you know, then when I started reading things online, like in medical journals, not just Google, that, you know, typically you'd be treated with hormone-based medication to stop ovulation and to slow down the stimulation of the patches of active endometriosis. I never had any of that. You know, you could look at my medical record, and after they removed that first endometrioma, it said endometriosis as a diagnosis. My primary care doctor never did any follow-up, my OBGYN never did any follow-up, never said, you have been diagnosed with a chronic disease that will need to be managed for the rest of your reproductive years.
Yes.
Nobody ever said that.
Yeah.
So I did nothing.
I'm going to be honest. I think that a lot of providers don't realize or don't classify, that's probably a better word, endometriosis as a chronic disorder. Right. And so it doesn't even hit our radar to treat it as such.
Yeah. And that's what it felt like. It felt like, oh, well, surgery resolved it. It's like, well, surgery resolved it. Why,
Yeah. Why am I back here?
Yeah. And, so, did the hysterectomy, lots of scar tissue, like we said. He had to cut away a portion of the rectum because there's so much, like everything was just fused together. There was this amorphous mass of tissue. I mean, it was benign. It's like, do you call it a tumor? I don't know the level of organization, but there was a thing that was in there that shouldn't have been there.
Right.
It formed at some point during these like repeated abscess process.
Right.
They don't even entirely know. And his take on it, after we did like the recap after everything happened, was sort of that the persistent inflammation from the repeated infection and the inflammation from basically prolonged untreated endometriosis, just like your body was constantly trying to heal things by throwing more scar tissue at it.
Wow.
And it had pinned, the scar tissue had just pinned my intestines and my gut completely to the abdominal wall and to other things and to things that it did not belong attached to.
Wow.
And everything was just like seized together. And it was maybe, I think I was day 3 in recovery from the hysterectomy. It's a little fuzzy because I was still probably off like heavy duty pain meds, but I like vaguely remember, I was like, yeah, my husband was there, my friend stepped in, the doctors would come and see me, and I'd like kind of open one eye and be like, yeah, it's all good. And then that third day, the resident, like a surgical resident,
yes,
not regular resident, surgical resident, who was she was running the rounds team. She came into my room. She wanted to look at the incision and everything. And, I remember my eyes were closed and I was just like, yeah, sure. And then she goes, what's that fluid? What's that fluid? And she started pulling the gauze off and pulling the tape off and basically like looking at the incision area, and there was like fluid coming out. She took off her mask, she sniffed the fluid, and she goes, we have to go to the OR now.
Wow.
Now. My husband had been in the room. Some of the residents that were sort of following her like broke off to go sit with him, and we're like, they said everything's fine, but you're gonna stay here. And next thing I knew, we were like flying down the hallways in the hospital. And that senior resident like grabbed my hand and was like right up next to my ear, and she was saying like, Christa, we have to go to the OR right now. She goes, you are going to be okay, but we have to move now. And I remember like I was, next thing I know, I'm like in the OR and all these people are talking to me. I can't really keep my eyes open. I'm not really recognizing people. And I remember them saying, do we start this now? Da, da, da. And they say, no, not until Dr. So-and-so, like not until his feet hit the entrance, like not until his feet hit the lobby. So They had to call in their on-call
attending
surgeon to come in. And then I remember I remember a beep and somebody saying, he's here, he's in the lobby. And then the senior resident saying, okay, start. And then I was out.
Wow.
Next thing I knew, I woke up in the ICU. Absolutely kind of like out of my mind because I had no frame of reference for this. I woke up, I remember lifting my hands and I had like Muppet hands because they had put padding to make sure I didn't pull out. Like you can still see, I don't know if you can.
Oh yes, the breathing.
Scar. but they basically had immobilized my hands so that I couldn't pull any wires off or anything like that or dislodge anything. And I remember them asking me questions like, what day is it? What year is it? Where are you? And I was like, I don't know. Like I knew my name, but I had no frame of reference for this whatsoever. I'm in a windowless room, a bunch of people standing over me. I can't talk. I have a tube like down my
hands.
throat.
I can't move my hands.
Yeah,
I have cords everywhere.
Right. I was like, I have no idea.
Yeah.
And then they sort of explained, that I was in the ICU. Everything was, I was going to be fine. Everything would be fine. I apparently was so agitated when I first came to that they called my husband and put the phone up to my ear because the nurse had said, like, your wife is really agitated. You might like want to explain. And I'm like, what happened? Like, what is going on? He said that a different region of my intestines had ruptured.
Ooh.
That is the fluid, like basically gut fluid. And so she could identify it by smell. And that 2 different sections in my small intestine had ruptured. And that they had to go in and cut out the damaged sections and put everything back together. He said I had been in a coma, like an induced coma for almost 4 days. I didn't remember any of it.
Right.
And that I was stable, but I was going to be in the ICU for a while. And I was in the ICU for another week and a half, I think.
Wow.
They didn't know if I had C. diff, so they were doing repeated sort of testing for C. diff. I wasn't allowed to eat anything. I wasn't allowed to drink anything for several days, which made me a very angry person. Like I was being pumped full of fluids, but there's something about your body desperately, like the thirst that you've never, it's like what I imagine it is like to be in a desert and not have water.
Right.
Like before you just, crumple up into a pile of sand. But they, they couldn't have anything moving through my gut whatsoever.
Oh yeah, absolutely. And that fluid, that is one of the worst fears. While I am not a, surgical NP in that aspect, I know we probably have some GI NPs, but absolutely GI docs, PAs, we all know, and just in general, we all know that fluid in the intestines, if it gets outside of that nice little contained space, is so very dangerous and can cause so many different types of infections because, again, that essentially turns into your poop. In layman's terms, for non-medical folks. So you've got poop developing kinds of fluids floating around.
Yeah, because it was like
areas where they should be.
It was instant sepsis. Having rupture happen and spilling bacteria, into the abdominal cavity.
Correct.
It was, so on top of sort of, the trauma from the surgery itself, and then a raging case of sepsis. They were kind of waiting to see. It turns out I had C. diff, but it didn't produce the toxin of C. diff.
Interesting.
Apparently, lots of people have C. diff, the bacterial strain, but they don't have the component of it that makes the toxin that is potentially fatal.
The part that other like nurses who work in the nursing home, the part that makes the poop and makes the smell and all of that.
Yeah. And it was a long recovery. After the week and a half in the ICU, they brought me up to regular surgical recovery. I was on so many antibiotics, I cannot even express the number of antibiotics, like IV antibiotics I had been on, everything under the sun. And I still had some sort of cellulitis around where the incisions had been for that second surgery. I was massively swollen. Like my legs were so swollen. They were trying to get me up to walk right away. And I was like, I don't have feet. Like, what? Like, I can't walk.
You're like, nothing is working appropriately, guys.
Yeah, like it was like just I was like an orb. Like I had no definition. Like, it was like my knees were as wide as my thighs, which were as wide as my ankles.
Yeah.
Like it was unbelievable.
Yeah.
And then when I was in surgical recovery, even after being pumped with all those antibiotics, I remember the one of the head doctors, came around and she said, Christa, we really need to make sure that there is no like pockets of infection happening. So I'd had surgical drains, like stitched in surgical drains. They weren't producing clear fluid like as quickly as they had expected
Right.
to. So they were like, there's still some sort of infection that we're not getting at. And you were like pumped full of vancomycin all day long. And still something is there.
Yeah.
And they said, we are going to need to take the sutures out. And she goes, we could do this in the OR. Normally, like sometimes we would go to the OR, just put you under and open it up and clean everything out really well. And as soon as she said OR, and I was like, no, no, can't do it. She goes, we can do it. We can do it here, like just under local anesthetic, just injected, probably lidocaine or something like that. Take the staples out, and then do like wound packing. And I was like, yeah, we're gonna do that. But yeah, they had to open up basically all the incisions they had made.
Oh my gosh.
And then that left me with open tunnel wounds. 2 different tunnel wounds, one from the top and one from the bottom.
Yes.
That was, especially the one on the bottom, I think at the start was 11 centimeters long and 4 centimeters wide. And, and the head doctor there had said, she goes, Civil War medicine comes in handy sometimes. This idea of sort of like that, if there's an abscess, you don't want the fluid trapped, and that it would be better off if I healed from the inside out, and to just let that process happen. But that process is very slow and pretty grueling. So, it was probably when I was finally able to be sent home, I was sent home with a wound vac, which I had never heard of. I had never seen, and it really was this battery operated pump attached to tubing, and they covered my abdomen with they would pack the wounds with wet gauze or wet sponges and then cover it with like a plastic sheet to hold everything in. And then it would apply suction to pull off the excess fluid.
Yes.
They sent me home with that. And then twice a week, home nursing care. That, let's say I went home from the hospital, maybe the end of the first week in September, had home nursing care to deal with the wounds. And it took until the end of December for the wounds to fully close.
Wow.
It was unbelievable.
Wow.
And then I, had a final visit with the surgeon, and he's like, if you keep healing so well, we don't need to see you again. And it was like such like a crazy journey that I just burst into tears. I hadn't cried the whole time. In the hospital. I think I cried a little bit because the food was really bad and I was starving. So there was like once I cried. But then at the end, I was like, I've done so many really hard things. Every morning they were repacking my wounds at 5 a.m. And I was just like, let me just turn on my playlist. I'm just going to zone out and just it's all good. We're fine. But it was when he basically said this is,
I think we got to the end of this.
Yeah, we got to the end of it.
But I mean, that was a 6-year buildup. And even before that, because we were having pain before the initial 2 surgeries.
Yeah.
So this was such a decade-long, probably longer buildup of, and then you get to the end point where it truly was, we got to survive now.
Right.
And all of your energy and conscious and subconscious was focused on just surviving.
I mean, and I remember saying remember grabbing my husband and being like, I'm going to fight so hard. You have no idea. No idea. We're just, and it was just, but I don't know where that came from because that is not my normal persona. I'm like, oh, that looks too
you
hard.
got some
I'm
fight in you if they had to restrain you. So, you know.
I'm like, I'm just gonna not do that. That looks too hard. And this was just like, no, this is, you know, I will get back to whatever, you know, this new normal is. You know, and the prognosis at this point, so you know, I decided, or at least at this point, I decided to not take hormone replacement therapy. Even though, you know, the surgeon had indicated the doses of estrogen are so low, so much less than what an ovary produces, that he really didn't have any concerns about it further stimulating any endometriosis. Because part of me, I was just concerned to be like, you know, if estrogen was sort of the gasoline on this fire, I'd rather just not have any.
I'd rather just not.
Yeah. Because even, you know, even when you have all these things removed, you know, it's like uterus gone, ovaries, both fallopian tubes, you know, that and whatever obvious patches of scar tissue or active endometriosis that they could see, they remove. But, you know, like we talked about before, that this is a chronic condition, and that even menopause doesn't necessarily mean an end to endometriosis. Like, yeah, it's probably going to be less stimulated without estrogen in the system, but it doesn't mean that those patches go away or that they become eliminated. And so they can continue to kind of grow and adhere to things and cause other problems.
At the end of the day, I think, you know, we know, you and I know, you know, when menopause hits, our hormone levels drop, particularly estrogen. We know it drops, but that doesn't mean. And I think there's a little misconception out there just from regular folks that when we hit menopause, we no longer have the hormones.
Right.
And it's just like, no, they're still there.
They're still there.
They're just at a very low level.
Right.
But like you said, understanding your body and how clearly sensitive you are to it, you just kind of, I understand you're not wanting to risk it.
Right. And I, you know, and I went kind of back and forth and asking that doctor, and basically asking, you know, all the doctors that I was confident in based on like how much they had helped me to sort of say, you know, do I have to, like, should I go on it? Because, you know, that surgeon that refused to do the surgery and refused to remove my last ovary was saying like, well, it's so important to have an endogenous, like, a natural source of estrogen, and estrogen does so many things in the body. And it was things like, you know, saying like, well, you know, you're at risk for like premature death from going through, you know, basically not having estrogen, you know, like before you would normally go through menopause. And then when I started digging into the literature, it was like such a minuscule effect. You know, it was sort of like, yes, you know, you need to be concerned about osteoporosis and things like that. And like some of the, you know, that is something that has like a really tight link to it. But she was acting like, if we take this last ovary, you'll be dead in 5 years, sort of thing. And you know, my like my A team, I was like, you know, and my surgeon said, like the one that had done my surgery said, you know, those studies are also in people that have otherwise healthy reproductive tissues. You know? And it's not on women that have such diseased reproductive tissues, that removing those diseased reproductive tissues is what's going to prolong your life. I mean, like, it would have killed me, you know?
Absolutely.
I feel like for sure I could have died at, you know, definitely, you know, with the emergency intestinal surgery and the sepsis and things. That it probably came close. Felt like it came
absolutely. I, you know, just even listening to your story, I do want to give kudos to you because you kept going back. I know it seems frustrating and not at all how we wanted this to go, but every time there was something wrong or you did not feel right, one, you mentioned it every time. And two, you kept going to the ER, you kept going to the urgent care. And again, that's one of those things where you and I both know that, especially when we know stuff, right? When we have the knowledge base, we will typically not. And we will just, it'll be fine. I'll take some Tylenol. It'll go away, you know, that kind of thing. But you were like, no, this you knew enough to know the way that this is escalating is not correct.
Right.
And it is very different. And I need to continue to keep going, even though it's not going the way that I'm hoping it is.
Right. Yeah. And I think even, leaving this experience and reflecting on kind of the path in my access to care and the level of care I was receiving, up until I really consider this last surgical team like miracle workers, that they saved my life. They saved my life from 6 years ago.
Yeah.
Everything that sort of went up to that. And that now looking back, like I now, I'm disappointed in my primary care.
Yeah.
I'm so disappointed that, I even went back there after all of this had happened to get a referral for physical therapy to try to help rebuild my core strength.
Yes.
Once I was cleared to do that. And I had an appointment with my primary care doctor, and she goes, well, why are you here? What can I do for you? And I was like, well, I would like to see a physical therapist. I have to go back to work soon.
Yeah.
My torso is like
a noodle.
Like can't hold me up for more than, 10 minutes at a time. Like I could use some help. And I said, and I've been through a lot. She goes, oh yeah, no, I read your record. And just nothing, not like nothing. I got nothing from her.
I'm sorry.
This is, a primary care person that I've had for over a decade.
Yeah.
I didn't get like, so sorry you almost died. Very glad you didn't. I got nothing. And
just disappointing.
She signed off for the PT referral. She's like, oh, okay, here you go. Just like so blasé and so like, and I was like, wow, and I left, and I'm not normally a crier.
Yeah,
but the two biggest moments of sobbing were like, well, my surgeon said I was going to be okay, and he doesn't need to see me every month the rest of my life.
Yeah.
And when she was so nonchalant about it, and I got back to my car, and I was like, I could have coded in front of her, and I think she would have just stepped over my body. Like she clearly, and just like for her to say she read my record is like, well, then you would have.
But let's be realistic. I mean, realistic in the fact that this is absolutely like traumatizing.
Yeah.
Point blank. This is a traumatizing experience.
This is the most trauma I have ever felt in my life.
Absolutely. And you read my record. The least you could do is say, I'm sorry.
Right. Or like, does it have any impact on this person as a clinician at all?
Yeah.
Like even just the recognition. I mean, I went to the dermatologist because one of the other side effects from the trauma of everything that happened in the surgery is I lost 70% of my hair.
Wow.
For 3 months in a row, I collected Ziploc bags of my hair.
Oh, wow.
And I would bring it into the surgeon, and he was alarmed because he's like, that's not normal.
Right.
But he had said, I think it's this particular condition, this telogen effluvium, where your hair regrowth cycle, basically like everything goes on pause when the trauma is happening.
Yeah.
And then after the trauma passes, like 2 months afterwards, the hair shedding cycle all reboots at the same time. And and I just remember like I just run my hands through my hair and it just was falling out in clumps. Like
which
I was
is also traumatizing.
Yeah, that was a little. I was like,
yes,
I can handle menopause. I can handle like these gnarly scars that will never, like my poor belly button will never look the same again. Right. And I was like, but I draw the line.
You're like at my hair.
Yeah. I was like, I draw the line at like instant baldness. Like this is like no. But then I felt like even going to the dermatologist, she was so sympathetic. And when I was sort of, explaining like what had happened, and she was overcome by it. And she's a dermatologist who, had the happy news of saying like, your hair's going to be fine. It's going to grow back. But she was like, I am so sorry.
But I think for anyone who's listening who has even remotely, some kind of empathy and sympathy, like this is traumatizing.
Yeah.
And I am safe and sound and sitting in my office. And I've heard pieces of this, and I've heard a lot of this story, but there are pieces of this that I have not heard as well. And I'm just like, is that what really happened? Because to take that all in, and again, this being such a long fight, like to have the stamina to go up against this, and then, like you said, push back against some of the best. It's not like you're in, some little podunk town. You are in one of the best areas for women's health ever.
Yeah.
So to kind of
our two
encounter
businesses
this,
are higher education and medical care.
Yeah.
That is the economy of Massachusetts.
Yeah.
And it absolutely makes me think of, what about the women that are not lucky enough to live in a location that has that infrastructure of healthcare?
Right.
What about, and it's like, and I still felt like I fought, wasn't heard, and then I still kind of backed off. Because I was kind of like, well, I'm not a medical doctor.
Yeah. Yeah, no, yeah.
But what about people that don't have that knowledge base to work from? What about the people that aren't able to advocate for themselves?
Mm-hmm.
Because it's like, I almost died and I had every advantage.
Mm-hmm.
And that is so disheartening.
Right.
And that's all I really could think about it, is sort of after this, was thinking about, what about all the other women?
What about
how many women have died because they didn't?
Absolutely. This conversation and your story brings up all the things of advocating for yourself, and really being persistent in that advocating and getting multiple, opinions about what is going on. And then, like you said, but it brings up that access piece, because we're able to get those opinions. We are able to switch, providers without a second thought. What about those who can't? What about those who look like me who can't, or who, Native American, whatever it is, but don't have that access and do live in a very small, tiny town, right. And don't have that access. It's scary to think about. So there is an unknown number of women suffering, essentially probably the same things you did.
And things where you say, endometriosis doesn't kill you. It absolutely can.
Yes.
Untreated, late stage endometriosis, I was told by the surgeons, that when they opened me up, it was the equivalent of late stage metastatic ovarian cancer. That is how unregulated the tissue growth was. Right?
Oh my gosh.
And thank goodness it wasn't.
Right.
Because there wouldn't have been really treatment options,
Right.
Or, that would have, thank goodness. But I have heard personally so many stories of women, especially younger women, that, present with pains that are ignored, and it is ovarian cancer. Mm-hmm. Like, in some ways, I also felt lucky that this was just endometriosis, even though just endometriosis almost killed me.
Almost killed you.
And that if it had been ovarian cancer, it absolutely, if it hadn't, it wouldn't have killed me right away, but it would have been terminal at diagnosis by the time they did anything about it.
Yeah. And then, but lastly, kind of your story definitely brings up for me as a clinician. And I, it's kind of one of the things that I tell when I'm doing the education and I'm doing the clinic quickies, I call them. We have got to do a really good job at just kind of doing the extra. At the end of the day, it is not going to hurt me to send my patient to go to someone else just to get it checked out. Right. If someone is complaining about something, who am I to say it's in your head? It's, I don't want anybody telling me that. That's always what I think. I don't want anybody telling me that. I don't want anybody telling my mother that. Right. Or my husband or whoever it is. Mm-hmm. So what is it if I simply just write a little referral? Sure. They can go do whatever it is that they need to feel like they need to do.
Sure, absolutely.
And it's like, we've got to do a better job at not essentially gaslighting our patients.
Right. And it really, it was my last, again, the care I had at Mass General, was to have, and one of the doctors there who was really one of her research interests is sort of patient outcomes. And particularly with gynecological oncology, it's sort of like not just, are we able to cure people and treat them successfully, but then are women sort of happy with like how they look and how they feel and all sorts of like aspects of, what is it to be healed from, usually they're dealing with cancer or to be dealing with something like this. And, I just remember her saying, so many doctors will not admit when they are out of their depth. Yeah. And so she felt like, the surgeon saying, oh, we don't need to do surgery. It really was that surgeon sort of saying, I know this is going to be messy. I know this will be risky. I don't really want to touch it. But the way that it's portrayed to the patient is, you're fine. It's resolved. Let's not go there.
Yes.
And I think it's so important for, and even she said, your own body. And that was, it's like you always tell yourself that. You always like think that. But it was so validating to have somebody of like her stature and her experience level. And she has seen like, the worst of the worst in terms of, gynecological cancers, and just sort of say like, yes, women know their own bodies.
Yes.
And so I always think like, that is what I will think over and over to myself every time I second guess myself, or like, let's say I develop new pains.
Yeah.
And I go in and kind of get brushed off. Like, I will never forget her sort of saying that. And after all years of gaslighting, to remind myself that every time that I am feeling something, that it is valid and it's that I am worthy of having that investigated.
Yes.
And to try to find clinicians that are also going to approach you as a patient that way, to approach your patient and say like, every person before me is worthy of figuring out
absolutely
what is going on and what is the source of this.
Absolutely. And I know there's fatigue, from both sides, from the patient side, the consumer side, you're exhausted. You've been to clinician after clinician and no one's listening, and you're tired of explaining your story. And then conversely, on the other side, clinicians feel like they see this all the time. But the only thing that, I can encourage both parties is one, like she told you, your body. So when something is not right, we do have to be persistent in advocating and finding that person who is going to listen, because there is going to be that one who does listen. Yeah. And then on the clinician side, yes, we have heard it before and we may have heard it many times, but this could be that one time where you're saving someone's life. Right. And so it's like, do you want to skip over that? It's like at the very least, send them to someone else and let them tell you it's good, or it's not good. So your story is fascinating. It is scary. It is so informing. There's absolutely some education that I'm going to do surrounding all of this, because there are terms that I'm sure folks have never heard of. I think that this is going to be great. And I hope that people listen to it and really take it in. Really take it in, because we're going to do a lot of conversations just kind of surrounding all of it. And maybe we'll reach that one person who maybe is like you and will eventually, hopefully, get their situation solved, and reach that one clinician that's like, I've not been doing what I could do the best way. I know how. Right. So again, we're always just looking to reach that one. So if we can get that done. But I thank you for sharing. And just so we have closure, because I'm always one of those people who watch a movie and say that we need closure. How are you doing now?
I'm doing really well. Good. I just started back to work full-time last week. So I have a slightly lighter teaching load than normal, but I'm back in the classroom and teaching. Good. And it feels really good. It's been a long time since I've.
Yeah, it's been almost a year, right?
Yeah, almost a year from
recovery.
Being able to kind of engage, in my life again. So that's really good.
Yeah. Well, I'm glad that you're doing well. And again, I can't wait for people to ask questions. we're going to try to keep up with all of that, and we'll keep you posted.